Kelly Gilson, and I'm the Executive Director with United Way Oxford. And joining us today from the Oxford County Community Health Center, we have Amanda Cook and Jade Davies. And I'm going to actually let them introduce themselves.
Hi Kelly, thanks for having us today. My name's Amanda Cook. I'm an outreach worker at Oxford County Community Health Center, as well as the lead for the Mobile Health Outreach Bus, otherwise known as MHOB.
And I'm Jade Davies, and I'm the Housing Stability Team Lead for Oxford County.
It is fantastic to have you both here. The Oxford County Community Health Center has been a long-standing partner with us. We've had a strong relationship, not just a funding relationship, but a real partnership in a variety of different programs and services. And the programs that the two of you lead are two of many programs at the CHC, but they're two that are really near and dear to our heart because we've been involved in many ways from the get-go. And Jade, I'll start with you on this one. Could you tell us a little bit about the program that you run, the Housing Stability Support Program, and the Transition House, and how that's making a difference in our community?
So we've been working with the United Way since 2016 to establish our Housing Stability Program. So currently we have a few programs under the umbrella. So we have transitional housing, which is in Woodstock currently, and hopefully to expand into Tillsonburg very soon. And at that program, we have 14 rooms that we use to support individuals that are experiencing homelessness, to go from homelessness to bridge the gap into permanent stable housing while being supported by the full-time support staff there that United Way currently financially contributes to. And then we have the eviction prevention program. So anyone in Oxford County that has received an eviction notice, which we know has significantly increased through the pandemic, can reach out to us, and we support getting connected to the legal clinic, support with technology for those hearings, and continue to case manage to ensure a positive tenancy in the future. And then anyone that has been housed in the last 3 months that has a history of homelessness or housing instability can also be referred to our community case management team so that we can support them in maintaining a positive tenancy, ensuring rent's paid, and those sorts of things. So that's kind of our housing team.
And it's so important because we've known for years that there's been tremendous wait lists for affordable, geared to income kind of housing, and there's a shortage, but that has been exacerbated over the last few years, has it not?
Absolutely. It's very hard to find market rent in community that our clients and our community members can afford right now.
And the wait list is years and years long, is it not?
The community is currently working on coordinated access, which will be more of a triage approach similar to like a waiting room at the hospital. And so we've partnered with Oxford County Human Services, who's leading that project, and we're a member adding individuals to that by name list and things like that. So Oxford County's full steam ahead and new approaches, and hopefully assisting in those wait times.
Yeah, and what we think is so fantastic is how the entire community, all of the service providers are coming together, both with your program and Amanda when we get to yours as well, because it really does take a village, and it's taking everyone working together to recognize that there's different points along the continuum. Each is really important.
Absolutely.
In a step and meeting people where they're at. And that's probably a great segue over to your program, Amanda, the MHA bus, because that really is a program that meets people where they're at.
Absolutely. It started in 2020, September of 2020, and it really got launched thanks to United Way when the pandemic hit, and we realized so many of the service providers closed, and our clients just didn't have access to a lot of the services.
Cut right off.
And everybody was by phone, by this. Well, a lot of our clients we know don't have phones. They don't even have homes, so how are they supposed to have a phone? So we launched MHOB, and we're out in community 3 days a week, just accessing. A lot of times we have primary care with us, so they're to help with any needs, antibiotics, prescriptions, wounds, things like that. And then we have CMHA. Like you said, partnership is really important to us. So CMHA comes out full time. We've had so many other partnerships come and go, depending on the needs of the communities, really. And it's it flows to whatever the clients need, really.
And you know what? We were so proud to be in a position to help to fund the launch of the bus,
Absolutely.
because we knew it was going to meet people's needs in the here and now in a way that nothing else could at the time, and we knew it would have longevity, that we could together build the case that this is an important investment.
Being able to meet them where they're at and trying to, like you said, instead of waiting till it's too late, because we know many of our clients don't attend the emergency room for many different reasons. It's not a comfortable place, they've had bad experiences, the waits can be so long there, whereas they know if they come see the bus, they'll hopefully be able to see a nurse or the nurse practitioner, or we'll get them hooked up with whatever it is they need and be able to be on the mend.
Yeah, and with the supports, with the right supports, people can really move on to a hopeful future, to better opportunities, but it is, in many cases, with really good supports and partnerships, right?
I was just gonna say that partnerships is really big, because Jade and I, we can't do everything, we don't know everything, but we know the people that know the right things and that can support the right way.
You know, I know that these are some of the programs that United Way has invested in with the Community Health Center. Are there other things that you're seeing, other community needs that maybe you'd like to share, that more emerging things or issues that you're noticing that we should, as community members, be very mindful and aware of as we move forward, because they matter and they're really important?
I think just knowing that many of the people that we assume are homeless, actually some of them aren't homeless. A lot of them are there because that's their friends they're with. So when you see people downtown and assume that that group is homeless, chances are 4 out of 5 of them might actually have a home, but they're downtown to see their one friend that might be homeless, or no different than if you and I were to go for coffee, right? So
That's a very good point.
I think people knowing that assuming people are homeless isn't necessarily who they are, and that people aren't choosing this. Right now, society, we just don't have the housing to support the amount of people, or affordable housing to support the people that need it the most. And so it's trying to figure out an Oxford County solution, because we are very different. Every county is different.
Right.
Every town in Oxford County is different. So what works in Woodstock isn't going to work in Tillsonburg. It's just learning the needs for each community different, and supporting the clients where they're at and what they want. It has to be client driven.
It does, and I think it goes back to that dignity piece in that respect, because the problem of how homelessness can affect all kinds of people in all kinds of circumstances, right? It is young family, it is single moms with children, or single dads with children, it is seniors, it's across the gamut, is it not?
Yes.
Absolutely, and especially after coming out of a pandemic, we saw that more than ever. Over 400 calls last year to the housing team, and individuals that had never come across these services before, working individuals. Low income isn't just, assistance at this time. Anyone could be a paycheck away from homelessness or eviction at this time. Like I said before, landlords are taking advantage of a hot market, and lots of properties that individuals have lived in those units for 10 years, and the price of rent to move into a new one is over double for that individual,
and just no longer, like, you can't budget your way out of that.
Absolutely.
No. Thank you both for joining us today to share a little bit about the good work that you're doing and the impact you're having on those you serve, because it really is making a positive difference. It is changing people's lives and offering stability for a better future, and we can't ask for more than that. So thank you both, and I thank everyone for joining us, and I welcome you to stay tuned for upcoming interviews where we will meet with other community partners and funded programs and learn more about the programs and services here in Oxford County, as well as what the needs are, so that we can continue to develop empathy and understanding and move forward together as a community. It truly does take a village. Thank you very much for joining us.